I'm Christina Bausch. I am a physical therapist here at Rebound Physical Therapy in Topeka, Kansas, and I specialize in a field of physical therapy known as women's health therapy. So today what we're going to talk about is how physical therapy can help relieve menopausal symptoms. So first, let's define menopause. So that is the point in which our ovaries stop producing hormones and releasing eggs. And it's really when we've went 12 consecutive months without having a menstrual period. So that's kind of how it's defined, but there's definitely a gradual process or a range to that. So usually menopause is going to begin in our 40s or 50s. The average age is 51, and it's going to take several years for that process to fully ride out. So usually, anywhere from 7 to even up to 14 years can kind of be that process before menopause actually fully occurs. So during that period is not always the most fun time in life. So you may be experiencing symptoms such as, hot flashes, night sweats, also maybe experiencing increase in incontinence or vaginal dryness. Those symptoms are things that physical therapy can actually help with. If we talk a little bit about what physical therapy, especially from a women's health side of things, can do. So we're really the experts that look at what's going on within the pelvic floor. So the muscles of the pelvic floor are going to be that support for the pelvic organs. So as we go through menopause and hormones are not producing as they were, those tissues are going to start to atrophy a little bit. So you're going to lose some strength in those muscles. And then also the tissues of the vaginal wall are going to start thinning a little bit. So there's some things that we can do to help with that. So we can help teach you how to find those pelvic floor muscles and make sure that they are able to contract properly as well as relax properly. And that can help to work towards a program where we're working on strengthening the muscles, which can help improve support, decrease any instances of prolapse or urinary incontinence, as well as bowel incontinence. And then also we can help teach you things that will help to increase the moisture to those tissues. So our moisture in those vaginal tissues is going to come from blood flow. So we can do things that actually help to bring more blood flow into that area, which is going to naturally help to add more moisture to the tissues, help with that tissue integrity, as well as offer suggestions of things that will, products that may help to add some moisture to those tissues so that you're not having to rely on hormones to increase that tissue integrity and help with that moisture. Physical therapists can also help put together an exercise program. So things that often occur as our hormones change, we may be experiencing increased weight gain. We're also at increased risk of heart or cardiovascular issues. So definitely exercise is a very important thing to be able to stay active with. And if you're experiencing pain or any other issues that may be limiting your ability to exercise, physical therapy can help to address those and help you to get on a good exercise program to help limit that. And then also, as we lose those hormones, our body becomes more at risk for osteoporosis. So we can also put together that exercise program to help with the bone mass, and then also prevent falls and improve your balance. So, it's not one of the most common things that you would think of for physical therapy, but is definitely something that can make a huge difference in your life. So if you're experiencing any of these menopausal symptoms, feel free to reach out to us. We'd love to sit down and talk and just kind of talk about what's going on with you, and we can put together a program to help get you back on track.